Hello and welcome to this session, Learning Outcome LO1. Understand the principles and practices involved in X-ray radiography. Today we will learn how X-rays help in diagnosing medical conditions. This session will explore the principles and practices of X-ray radiography, a vital diagnostic tool in medicine. From the production of X-rays to safety measures and image formation, we will examine how X-rays allow us to visualize the internal structures of the body accurately and safely. X-ray radiography is a crucial imaging technique in medicine. It uses ionizing radiation to create images of the body. This method is quick, non-invasive, and effective for detecting various conditions. X-rays are part of the electromagnetic spectrum. Their ability to pass through the body forms images based on tissue absorption. X-rays are produced in an X-ray tube. The cathode releases electrons when heated. These electrons hit the anode, creating X-rays. X-rays interact with the body through absorption and scattering. The resulting image shows varying densities based on absorption levels. X-rays pass through the patient and are captured by detectors. Differences in absorption create contrast in the image. Bones appear white, soft tissues appear gray, and air appears black. High-quality images depend on controlling kVp and MAs. These settings affect image contrast and density. ALARA is a key principle in X-ray practice. It stands for as low as reasonably achievable. Protective measures include lead aprons and collimation. Time, distance, and shielding are crucial for safety. Legal standards like IRR 17 and IRMER 17 ensure protection. Patient preparation is essential in radiography. Confirm identity and explain the procedure. Remove metal objects and check pregnancy status. Correct positioning ensures diagnostic images. Exposure settings depend on patient size and clinical purpose. Errors can affect the quality of X-ray images. Motion blur occurs due to patient movement. Underexposure results in a light image. Overexposure creates a dark or burnt-out image. Poor positioning leads to distorted images. Radiography involves a step-by-step process. X-rays are produced in a tube and directed at the patient. Different tissues absorb X-rays to varying degrees. The detector captures the transmitted rays. This forms the basis for image contrast. Detection depends on the system used. Film screen systems use photographic film. Digital systems use electronic sensors. Detectors convert X-ray energy into electrical signals. These signals form the digital image. Digital images undergo processing for quality. Computed radiography uses lasers to scan plates. Direct digital detectors convert photon energy instantly. Software adjusts brightness and contrast. This reduces the need for repeated exposures. X-ray techniques reveal internal structures. They differentiate tissues based on radiation absorption. Dense structures appear white, soft tissues gray. Radiographers choose techniques based on clinical questions. Multiple views ensure accurate diagnosis. Different techniques offer various diagnostic benefits. Plain radiography is ideal for fractures and blockages. Fluoroscopy observes real-time movement. Contrast studies highlight soft tissues. These techniques aid in identifying complex conditions. X-rays are used for screening and monitoring. Mammography detects early breast cancer. Serial X-rays monitor healing and disease progression. Quick image availability aids in emergency decisions. X-rays reveal trauma, bleeding, and foreign bodies. X-ray techniques provide a clear clinical picture. They reveal structural changes and abnormal densities. Their speed and accuracy make them invaluable. X-rays are often the first tool for quick, reliable answers. They remain a cornerstone of medical imaging. CT scans produce coronal and sagittal images. The scanner rotates around the patient, capturing slices. These slices are reconstructed into cross-sections. Coronal images are stacked front to back. Sagittal images are stacked left to right. CT systems create three-dimensional images. Volume rendering combines slice data into a digital volume. Lighting and shading enhance the 3D model. This helps understand complex structures. CT scans are valuable for diagnosis and planning. CT uses multiplanar reconstruction for flexibility. Axial slices are reorganized into coronal and sagittal views. This process doesn't require new scans. It enhances understanding of anatomical relationships. CT's flexibility aids in various clinical scenarios. CT scans are integral in clinical practice. They provide detailed images for diagnosis. CT helps in trauma assessment and surgical planning. Its ability to produce detailed images is unmatched. CT remains a critical diagnostic tool. CT scans offer unparalleled diagnostic detail. They provide both two-dimensional and three-dimensional images. Their flexibility and detail aid in complex diagnoses. CT scans are indispensable in modern medicine. They continue to evolve with technology. Conclusion: X-ray radiography and CT scans play a vital role in medical imaging by providing detailed insights into the internal structures of the body. A thorough understanding of their underlying principles and proper application is essential for achieving accurate and reliable diagnoses. For support or questions, send a WhatsApp message to 07484300 and 61688. We're here to help. Looking forward to the next session.